Welcome to the NorthLakes podcast. I'm your host, Jeremy Oswald. Today I'll be speaking with Brenda Spurlock and Xristobal Ramirez Romero, who are both community health workers at our clinic in Ashland. What's a community health worker? You tuned into the right podcast.
I'm Brenda Spurlock, and I'm a community health worker here at our Ashland Downtown Clinic.
And I'm Chris Ramirez Romero, and I'm also a community health worker here at the Ashland Downtown Clinic.
What is a community health worker?
It's a good question. It can be a lot of things depending on the day. It can be us being patient support. It can be us being, staff support. It can be provider support. But I think the big delineating factor is that community health workers specifically address social domains of health in our clinical setting here, which essentially means that the stuff that happens outside of the clinic, we know affects the stuff that happens inside the clinic. Community health workers are there to help address those needs as they arise and to navigate that with our providers.
Absolutely. We are connectors and we are supporters, and we encourage and seek out information that will benefit patients' lives. And of course, we focus on those social determinants. But I think what we do is to just help remove some of the fear and intimidation of a healthcare system. There's no wrong question to ask. There's no wrong door to come into here, which is terrific. And we're there to navigate that alongside patients.
How does that work? I understand what you're saying, but let's pretend, hey, I'm Jeremy Oswald and I could use a hand. How would you go about helping me? I've just come in for an appointment. I'm having a little trouble kind of being here. I'm having a little trouble maybe what would be some things I might have trouble with where you two would jump in and help out?
That's exactly where we would begin. And it starts with our fantastic front desk staff that recognize these things, and we'll place them on our calendar. If we're able to see them right then and there, we will. But then we sort those things out and we determine from that point on what's most important, where to go next, and assure them that they've got a person here that will walk alongside them as they navigate things going forward.
Yeah, I'd say how you're asking how would someone access us or how would we begin that process? And I think that that process looks different for every individual that we engage with.
Yes.
So for yourself, you said, coming in for an appointment, right? And you have these things that you're struggling with. If at any point during the appointment that those items are brought up or identified by any staff member, generally we'll get notified via our internal messaging system and coordinate ways in which either Brenda, myself, or now Sam Chrisman, I think is his last name, is a new community health worker here, how we can get in touch with them, whether that be a warm handoff. Sometimes we have, or a lot of the times it's getting put on our calendars for some intentional one-on-one time to discuss those needs and see, like Brenda said, what needs addressing and when.
And how did this come to be? I mean, I guess I kind of grew up in a traditional, well, not traditional. My uncle was a doctor. So we would, hey, Uncle Kurt, we could use a hand. And, I don't think he ever gave us a bill. So I guess I shouldn't say traditional, but he was a regular DO. He had his own office, and then he had, he worked in the hospital. But, this didn't exist then. Do you have a grasp of how this came about or how this position came to be? Is it unique to community health centers, or I know you're not historians, but do you know any of that? How this came to be?
I think we can certainly thank the vision and the mission and leadership of NorthLakes leaders. And it was developed, this particular model of community health worker is unique. However, all FQHCs have staff on hand that are there to provide some supports. That's those safety net services you might refer them to as. But it is unique here at NorthLakes that we are specific specifically addressing the social determinants of health because
I guess I'll stop you there because I don't know if I know what the social determinants of health.
Oh yeah, that's legitimate.
Yeah, that's probably something that should get asked first,
Yeah.
Social determinants of health is where we were born, where we lived, grew up, what kind of access we had to healthcare, to education, what our communities looked like, whether they were inclusive or if they were indeed isolated, all of those things. And of course, one of the major things is if you have access to insurance and healthcare from your local clinic. And those factors play a very large role in what your health and wellness is going to look like over a lifespan, and also for your children. So I think it's very important, and it was very visionary to really address those where we live for all of those reasons.
I think maybe even, yeah, we're not historians, right? But I think we have a pretty decent understanding of the pathing of healthcare recently, in that traditional healthcare centered around physical wellness and addressing symptoms and addressing those symptoms in a way that hopefully led to outcomes of a person having a better life or having better health, right? Then we started looking at what are the underlying things causing these symptoms to arise and how do we address those needs, and science developed in that manner. Then we started realizing that people's brains sometimes need different care than their bodies does. And we started talking and having whole fields of mental health and mental well-being develop from this, partially abstracted version of physical health being only about the body, now including what we have in our brains as part of that health. Now I think we have kind of had this progression where it is largely recognized and documented that those social determinants like Brenda described affect those two things more than just about anything else in this world. And if we are to really provide actual care to people, it doesn't just stop and end when someone comes into the doctor's office or in their therapy session. That the development and continuation of health and well-being happens at home with family. It happens at concerts with community members. It happens at game nights. And it happens in places that we don't traditionally think of our health and well-being as being fostered and developed, but the reality being all those instances that stressors can be added to somebody's life affect their physical and mental well-being, their health, for the word that we use, healthcare. So the community health workers, I think, are just a natural continuation of that process of us understanding that we're really complicated things. People are complicated. And the second we start delving into one thing, we're probably jumping into a pool of 100 other things. And that's okay. We just need to have the supports necessary to help navigate those other 100 things too. And that's where I think we get slotted in.
So there was, knowing that, at the conception of NorthLakes, that was sort of recognized and hey, we're going to create this position. We're going to create this job, community health worker, that will assist people with that, to help break down those barriers. I love that in our mission. I'm looking around. I see you both have your name badges on, and I love that it's on the back of each one. And it's kind of evolved since then. There's now, we try to have them scattered about our service area. And I've been lucky enough that I get to sit in on some of your meetings, and it's always really neat to hear what you guys talk about.
I'm glad you feel that way.
Right. So is there any more about that history or about, so I kind of derailed you there a little bit, Brenda, when I asked you about the social determinants of health. I didn't mean to. I
think it was an evolution from the original model where it was primarily handing out things. People needed simple things, obviously gas cards, bus tickets are things you need to get to appointments. But I think that the leadership of NorthLakes recognized long ago that there's much more to it and what people actually need. And so that led to developing the model that we have with our community health worker team about really addressing head-on those social determinants. I failed to mention that transportation is one of the biggest barriers, of course, and we're a rural. We're always going to be a rural community, and so if you can't get here or if you can't pay for the visit, it's obviously not going to happen. And so those were some of the primary things that clinic leadership focused on to make sure at least we're going to get you here, and then we're going to work on things from there. And so we continue to evolve and hopefully fine tune this model. It's been really been satisfying to see that this is a focus of the clinic.
Without a doubt. I and that's why I really wanted to speak to, well, and I'm happy to speak to the two of you, but to have some community health workers in here, because I think it's, what does our CEO call it? You're our special sauce.
That's excellent.
Chris is much spicier than I am. I just want you to know.
Drop a little jalapeno in there, man. That's all right. I'm into the spice.
Right.
But that does make sense, and we're kind of the sticky glue between service providers and community, and trying to make sure that we navigate those optimally for each person. It's obviously person-centered, and one person doesn't have the same needs as the next. But I think we're pretty adept at managing that and making sure that we are accommodating all needs as best we can.
And what would be, I think we had some questions we sort of threw around before we started, and I wrote, is there a typical patient that you work with? And I don't think that's I don't want to say that, although I just did. But maybe a better way to phrase that is, what are some common things that you're helping people with? What are some of the barriers that you're helping people with?
I think literally the first thing that came to mind was housing, because it's generally the most pressure that you feel in this position is centered around individuals' housing. And it is probably the hardest part of the social domains to navigate, because housing is predicated on housing access, housing availability, and in general as a topic, it is such a multifaceted thing that when people are struggling with their housing, generally there's other underlying things that are also in need of navigating as well. So a lot of, I'd say transportation and housing are generally the two largest drivers of patients, towards community health worker services. And I could elaborate on that for sure, but I think Brenda, is there anything else that you think that we see a lot?
Well, I think in that I somewhat specialize in the behavioral health area. There's huge concerns. There's fear among people in addressing some of those needs and understanding how to access them, and just being something as simple as explaining what our paperwork says and going through it with a person is incredibly helpful. We're in a really fast-paced world, and we shove everywhere you go. People are shoving papers in front of you, and you sign them. You don't have any idea what that is. And when you need to share history when you are seeking a behavioral health provider, it can be very daunting. And so I certainly enjoy that I am able to walk alongside people and help them with that and answer the questions they might have in hopes that when they access these services, they get the most out of them. And a lot of what I also do is help process after appointments, or if there is additional support needed in between appointments, to just really work with maintaining that health and wellness. So it's there is no typical patient, and it's really nice working with Chris. Is we obviously have different backgrounds and different skill sets, and we work really well together. And I think we have cast our net very wide, and the net feels safe. I
have to imagine that has to be helpful to the providers and the rest of the people that are here offering care. That if you can, to save time when somebody's in an appointment with a provider, they're not talking about like, hey, this paperwork doesn't make sense to me, or that you're able to assist with those questions so that the care can happen.
Yeah.
Absolutely.
It's incredible. Literally went right over my head, like that the care access is like actually probably one of the largest feeder to the community health worker program. That navigating the paperwork bit, developing relationships with providers is something like it's like to navigate as well. Like people who are seeing one provider else like at another clinic coming wanting to learn about who we have here, we're able to bridge that gap for community members without them diving right into seeing somebody right away. And that itself can be super valuable. We get so many referrals like that, actually.
We do. So, and obviously we work with our community partners, whether those are service providers or other supports, social determinant of health type supports in the community. So we're always, working together in this larger community setting to make sure that we're doing what we can for each person.
Yeah.
And how do you work with the provider? How does that happen? Is there a typical, what would be an example of how you work with a doctor or a behavioral health therapist, or give me any other example you'd like?
I think there's really simple requests that so-and-so missed the last couple appointments. Can you kind of check in and see what's going on? Absolutely. To someone who's navigating some really complex medical issues and knows that this person or family may need additional help to understand what's going on and manage appointments or scheduling those appointments and getting to those appointments. And so they've gotten really comfortable in referring simple or complex, which is great to see.
And then after that occurs, like there's a lot of informal teaming that occurs, like where we'll interact with each other in each other's offices to touch base regarding folks that we're working with, or we use an internal messaging system through Epic where we can send instant messages to, discuss what's happening with somebody live sometimes. So there's formal teaming that occurs during staffings and briefings and stuff like that, and organized meetings. But the reality of our work is that it occurs in this kind of liminal space, where we are sometimes called in directly to patient appointments to assist. And we also have those scheduled appointments. But those scheduled appointments a lot of the times are referred by those providers so it's the way that it we engage with providers, again, the typical provider. Yeah. It's all
typical
over.
Provider, which I haven't met yet.
Yeah, right.
Which is why we're here.
Dr. Typical.
Dr. Typical. Right.
Yeah, man.
How did you develop that relationship? I don't know how to ask this, I guess. It's but I can't imagine you guys showed up as community health workers and the other providers great, come on in. I need your help. But I'm going to guess that, and you've both been here for a while and you've had to build a relationship. What was that like?
Brenda saying good morning to everybody for 2.5 years. And
I was smiling and saying, what can I help with? But you build trust one-on-one, and they watch and see the work that you do, often witnessed through the patients that they're seeing. So, hopefully there's some positive feedback that's happening. And so, it was hard. It's hard to adjust to something brand new when you are a provider and used to a way of doing your practice. There's certainly, so this was an adjustment for everybody. That's real. So it takes time, but you're friendly, you're respectful, and you build trust, and they know that you're there to provide quality work. And it just happens then over time. Takes a while. Takes a few laps.
Yeah, I echo every sentiment of that. And I think like the idea of it taking time, like relationships, like you said, don't happen overnight. Sometimes they do. Who knows, man? Like we've had some providers that get into like the clinic and they're like, thank God we have people like you around and immediately start sending stuff our way. But the natural occurrence of like just developing that, that notion that like we're dependable and we have like skill sets that are like very useful for the individuals that we work with and very useful for you too. That we are not just a resource for our patients, we're a resource for you as well, just as you're a health resource for Brenda and myself and behavioral, like whoever else is in this clinic, right? Like we have things we can offer to the team. Ours is just a little different. And once they see the results, that feedback piece from our patients, like that's, I can't stress how pivotal those like, those are informal conversations too. Like the provider doesn't prompt that from the patient, but the work that we do, and I don't want to sound pompous, but it does speak for itself in that I think we have a very intentional way of being with people, and we get the opportunity to hold space for those people and create what I think, and I love to call it this, like a healthcare home rather than just a health center. Like this is a place where people feel comfortable spending time, and it shows in their appointments. Mm-hmm. Yeah,
it does.
So,
and what got you two into this? What drew you to this work, or how did you find out about it, or what are your backgrounds a little bit that landed you here?
Yeah, so my background, all before this, was in politics and in specific community organizing. And after my last election cycle, I was feeling not really that energetic anymore. So I was taking a little bit of a break. And during that break, I had a interaction with an old friend who happens to work at NorthLakes and discussed this resource coordinator position that NorthLakes had, and that it was centered around like really increasing access to like resources and to like increase access to healthcare. And that, Chris, it's something that I think you could be like pretty good at. So if you're ever interested, like give me a call. And I let that sit for like a week, and I was like, I could not stop thinking that this is like one of the coolest ideas ever. Like that this is like everything that I would like to see in the world. Like people. Oh yeah, go ahead.
No, so you didn't know about it either.
I had no idea.
What happens there?
Yes.
You do what?
Literally could not stop asking questions. Like I did not believe this was something that health centers or a clinic could do. I was a very sick kid. I spent tons of time in the hospital. I was in and out of North Shore Clinic in Lincolnwood. Like I can't tell you like how many appointments I had. Not once did I, and I don't think like, this is not to bash them, but not once did I ever know that something like this could exist in a clinical setting to make people feel better. I think about times where I didn't know what was happening as a kid, and where my mom didn't know what was happening, or my grandparents didn't know what was happening, right? Like how good it could have been just to have anybody to provide support. And that's like literally just one facet of what we do. And to learn that there's somebody like a position that can do that, but also do so much more for people going through things similar to what my family had to go through. It's an amazing thing. So I landed in this work because I heard from a friend that there was this really cool thing that this clinic was doing, and if I was interested in it, just to ask. So I asked, and I was interviewed, and I was hired. And that was at the end of 2018. I was hired in March of 19, and I've been here ever since.
I have had a long history of helping human beings. I hope It's been a priority for me to support the wellness of others. And certainly, you're aware I've worked in another setting. I worked in criminal justice for almost 24 years in the area. And I knew of NorthLakes. And in fact, NorthLakes came inside the walls where, inside the correctional facilities. And I was always impressed with the passion, with the intelligence, with the agility of people at NorthLakes. Like, if there's a problem, we're going to figure out how to help you. We're going to try to, solve this problem. What kind of problems do you have? Let's see what we can do. And it began actually partnering with a grant writer that NorthLakes had years ago that was fantastic. And it was so refreshing. And there, there's wonderful healthcare providers all through our region, but I was very familiar with the faces of NorthLakes, and it was a passion of mine that when I was done with that career, I know where I want to go. They're my people. So that's what happened. And
I'll tip my hat a little. I knew your story, and I'm glad, but I wanted to prompt it out of you. And I guess I can. I knew you then, and I don't know if people know the work that you did before here. I bet they do, but I saw it and recognized it for what you did for. And I was always impressed. And when I heard that you were here, I was like, oh yeah. That's a good fit. You too, Chris.
Yeah. Oh, yeah, absolutely. And I know we're off, but what a delight. But I recognize similarities. Like I said, let's do this. Let's go. Let's get something good done. And that's certainly what the attraction was. It's like, okay,
you're here.
And the and I'm thrilled you're both here, by the way, because I think you two are such a neat pair. And I'm a little jealous that you have each other. Not that you have each other, but I just think that it's like, I can just I am guessing the two of you have little talks together, but you complement each other very well, is what I'm saying. Yes.
I feel that way too.
Yes.
Yeah. I'm really lucky.
Yeah. What I got, this is kind of a two-parter, and we can do, you want the good news or the bad news first?
Bad news.
Bad news?
I'm a bad.
Well, this is, I don't mean to put you on the spot, and you can tell me not to answer this, but tell me about a time when you weren't able to help someone. I think you do lots of great things, but I'm out in the world, and sometimes you're not able to help someone. Has that happened to either one of you? And what's that like, or who or how? How couldn't you help someone?
It happened today. And I won't share specifics, but a lot of the things that. This may come off as pompous, but I'm going to say it anyways. Anything that I can fix, I'll fix.
Oh, yeah.
There's no doubt in my mind that once I set forth on a path with somebody that I will see it through until it stops. And that can be hard sometimes, because sometimes it stops sooner than you think. So just today I was navigating something with a gentleman that I've been working with for a little bit, and it's a small loss, right? This was not something that catastrophically affected his life, thankfully. So I don't feel terribly, it's not terribly difficult to talk about, but it's centered around very mundane procedure for transferring a phone number to get somebody SafeLink, right? So it can be as small as a phone call going poorly with a representative where they don't understand what you're saying and they totally botch all your paperwork, and bam, that application that you had been doing is essentially ruined. All the proof that you sent in doesn't matter anymore, and you have to start the process over. And that happens not because I didn't call 4 times, and it doesn't happen because I didn't fax something or that was not within my control. But the result is that the individual I worked with is like doesn't have a cell phone right now. Like that's terrible. That's not terrible, right? It's a bad outcome.
If I didn't have my phone, I know I'd at least be bummed out.
Yeah.
At the least.
Cool. Yeah. So the thing is, like, sometimes it's just the process itself that causes it to not be a successful, thing. I don't know what I'm trying to say, but yeah. And that's one time where it doesn't work. There's other times where it doesn't work because it just doesn't.
We have to rely on we aren't sitting there with a full arsenal of supports and services that people need. So we have to rely on our partners, and we most of the time that goes really well. But I think that it is fair. I'm glad you asked the question because it does happen. It does happen that we can't do. We can't navigate all the hard things and solve them for people. What we do, though, is take some really big problems and make them smaller and hopefully more manageable. And I think that people recognize and appreciate that we're in the game with them there, trying to do this, that we are there supporting them, and that trust and that alignment is felt. And there has been, there's been a number of times, I'm sure that you hear it very frequently, that, it didn't work out, but I really feel good that you did everything you could, and that's where we live, is we do what we can. We can't fix it all. We never will fix it all. But if at least you are side by side and doing your best, people appreciate that, and at least they can leave with a side of dignity.
Well, and I'm there. You said you had been working with this person for a little bit.
Yeah.
And that must give them some, I don't want to say confidence, but at least like, well, I know Chris, who I trust, was out there doing it all for me, and like trying to make it happen. And so, and they weren't alone. They trust you. Did they trust you? I assume they trust.
I hope so.
Okay. and so for them, like that, they weren't walking the path alone.
No. Mm-hmm. No, and throughout the process, he would look at me and say, I don't know if I could have done this.
Yeah.
And I look back and I say, I don't know if I could have either.
But we're teaching skills
together
while that happens. We're teaching.
That's exactly right. And
modeling that.
In modeling it, I'm also developing my resilience and skill in navigating this. Like, okay, that didn't work. What next time can I do to maximize my impact in this process? And if it is like being more active in, I don't want to say push, being more pushy on the phone. I'll just say if it's being more pushy on the phone, or if it's me utilizing very specific language when I'm navigating the system so I get the result that I need. Like, yeah, it gives me the opportunity to learn. And when I say I don't know if I could have either, like that is kind of a genuine thing in a lot of the things that we do navigate. Like it is not, there's very little of a typical, like we talked about, there's very little of a typical case for any given thing. So it is usually some level of a first of me going through a thing with somebody. And that's like, I'll be transparent if that's the case and say like, I can't tell you that I've like done specifically this thing before, but I'm like ready and willing to do it for the first time with you. If you're like, okay, navigating that with me. And generally the answer is like, yes, because it's a terrifying thing to do it alone. But I think sometimes it's yes, because they're there to be with us, to go through it with us.
This is, sounds like this is a hard job. How do you guys take care of yourselves? How do you, like, after that, like something isn't successful, are you both able to kind of like, of course not. You're not just walking away like, oh, that's the way it goes, but that has to be hard.
And Brenda and I have each other. Like we really, during the pandemic in particular, leaned heavily on one another for support throughout throughout everything. And like still, like literally this morning, Brenda came to check on me because there was something difficult happening yesterday. So like it is a matter of mutuality. That is, and that's like navigating it on this end, right? Like I do stuff for myself. Like I play Overwatch, I play guitar, and I sing in the kitchen and cook for like 2 hours a night. Like all, so like there's all these things, right? But in the job, like my coworkers, the people that are around me, those are the individuals that get me through.
Yes, indeed. And we have a wonderful team here, and that you can feel that support. And, you know, it's not just on paper. You can feel it because you've developed those relationships within the network of providers, and you know that everybody's doing hard things. And I think what's really special is that everyone is committed to doing the very best every time, to the best of their ability for this common mission. And that's set. So, you know, we're also not alone.
Yeah.
So that's very, very helpful. And they eat.
Amen, man. That's right.
That may have been the first.
The proper answer is quesadillas.
Yes.
That's right. Yeah.
I'm going to go with quesadilla.
Yeah, that's right.
For 200.
Yeah.
Right. So
Sounds
the good
great.
news, tell me about a success.
Oh, you want to?
I'm thinking of one too.
Okay, you go ahead. Yeah.
Oh, I'm trying to. If you have one.
I think one that was especially rewarding was quite recent, and it was someone with a lot of deficits in the area of social determinants, and including a long criminal history, and just being able to work with the person to get them to a place where they realize they deserve good care. They should access good care. They should follow through with that care, that there's additional support that will be non-judgmental. Nothing huge happened other than they got connected to the right resources and are on their way to hopefully having a successful disability filing, because they got hurt really badly at work, and not letting pride is not a social determinant, but sometimes pride gets in the way of people thinking they deserve care and will not even access care. And so it's been a long road with this person, but I can see and feel the difference, and they are recovering and living their best life right now, even though it looks really different than it did last year. That feels pretty good.
It's a big one. Gosh, okay. So I'm having a hard time with it, partially because, like, and I'm sure you feel this way too. Yes, there's a lot that I can think of, but also a lot that I'm like, I'm not sure if we're really all the way done. And like, I don't think that, so I have to like frame my mindset and think like, all right, even if like we're not like, you know, I don't know, where the end goal could be, we're where an end goal once was. And so there, like in particular, there's someone I've been working with long term that has like, we have been on top of it in terms of like finding forms of assistance and applying for them and ensuring that they're able to receive them, tackling things that were happening in personal life, tackling things that were happening in their in their legal life, like tackling a number of these domains as they like were arising, right? And initially the goal was I would like to file for disability. And like, that's excellent. That's a very attainable goal. I know how to navigate that. I've done that one before, so we don't need to go through that one. But like the process didn't stop. And that's like, I think one of the things that going back to the hard stuff of this job is that like, it doesn't necessarily always have like this clear delineated end. So thinking of wins, like I literally, like when you said, like, have you had like a success? I was like, yeah, man, I just had a really great one like this morning. So, and like, for me, it was like that success this morning was I've been able to provide like social support to this individual who's elderly and doesn't have a lot of friends and family in the area, doesn't interact with them very often. So after their chiropractic meetings, I have been a point of support for that person. And we meet weekly. We meet for an hour. We talk about family. We talk about food. We talk about fun. Sometimes she needs additional resources and we'll navigate that as those things arise. Like sometimes it can be as simple as needing, household items, right? Every time I meet with her, I feel like there's some level of success because she's continued to meet and she's engaging with a person that she enjoys engaging with. Like, right? Like that's the win. So successes happen every day of every size. And those successes will never stop because I think like the success is when we're able to actually do the work. So we do the work every day.
What, again, I'm having a hard time phrasing this, but you guys are really smart and you're going to be able to help me through my question. You're going to assist me with this.
Yes.
But and I'm going to use the word typical and be stereotypical here, but I guess like, I think you and maybe here at North Lakes, we might see things about people in our town that not a lot of people see. Like I think that a lot of it might be hidden and people might be surprised about things. And this is where I need your help. I think you know what I'm asking. Yeah. And can you expand on that a little bit?
I do, and I can specifically refer to the endless pandemic. So I'm going to say the number one thing that I think that is hidden is the loneliness in this community.
100%.
And that's where Chris and I have been the resource, among all the other wonderful providers and things that they do. But they know we are here and we are front facing in the chair when many other entities were not. And we have listened to a lot of sadness and reflected with people and encouraged, but the loneliness is palpable. And if you can imagine how, we're in Ashland and there's a fair amount of stuff going on here. Can you imagine the isolation that's felt, because we're working with people from all over the community. So we try to be the bridge to any other connections that they can make. And when during that time when there were so few to make, we did a lot of that. And I think that is something that we don't talk about. And I would suspect that had great impact on physical and mental health in our communities everywhere. So the fact that we can be who we are, doing for this organization what we do, I think it's pretty cool. And I think it's had impact.
I think so too. And I think that loneliness bit is like the biggest unseen. The level of people feeling isolated, the level of people, the number of
it's hard not to do, right?
Yeah. It is. The level of isolation felt by many people is it's shocking. And, it's not always the first thing that is brought up when we begin engaging with somebody, but it is like fairly quickly comes to the surface in terms of Well, it helps that we have a screener that asks, like, do you
Yes,
feel
that
lonely
is
and
part of
isolated?
our screening tool, which is, I'm really glad it is.
Me too. Because
yeah.
after that question, it's always surprising to me the number of people who don't have someone they could call if they need help. Or that say, I used to, but I don't think I can anymore. And those, like, that isn't, that is usually not the only thing that's happening in these people's lives. And I think that that is maybe after financial, like, solvency, or I don't know what word you want to use, like being able to like pay for everything, right? Like outside of that, loneliness, I think, is the biggest exasperation factor too. Like it exaggerates, it augments like a lot of the things that like we are there to begin addressing, like people who are lonely and homeless.
Yeah.
Like that's the loneliest I've ever seen a human being in my whole life. But being lonely and housed, being lonely and living with family, being lonely and living with a spouse. Like, I don't know what happened to human connection over the last 3 years, but people feel like islands right now. And I don't necessarily always know where to go for that, because if you look at Ashland, there's like you said, there's a lot happening here, but that narrows down when you're looking for sober events, and that narrows down more when you're looking for free sober events, and then even more so like when you feel like you aren't a part of where you live. It's scary to go places. And it's not the grocery store that we're saying go interact with people in. We're saying, get out there and engage with the strangers. And then sometimes I go, well, I was a stranger once and look how this has gone. But like it doesn't feel good to be lonely. And I think that isn't talked about enough. And as like an unseen thing, chief amongst them.
Not the answer I was thinking.
What were you thinking, Jeremy? I'm interested in this.
No, I
Really?
Well, I guess, I was going to be dramatic, and I was going to say like, there's a huge drug problem in this town,
well,
I mean, like
that's the typical response,
right?
Yeah.
Like,
but underneath
The drugs.
the drug use is loneliness and disconnection, and families that have broken down, and systems that aren't built to handle all of the diverse population needs that we have. We talk a lot about inclusivity, and it's a lot harder to have and see happen than it is to talk about it. So we've got lots of work to do, but the good news is we're doing the work that we can. We are fortunate to be allowed to do that within the clinic setting and within NorthLakes as a whole. We're grateful for that vision to start and develop this type of a community health worker model, and hope that we can continue for a bit.
And to piggyback off that, if that's all right, like fundamentally, this gets at like you asked the question how this position kind of came to be. Medical science, like the medical field, had a lot right about understanding how to discern what is actually hurting somebody, or what is like what is causing these symptoms to present, like what, and they developed the word pathology for going back and learning how something develops, right? And I hesitate to put like the word pathology on the method that, but we're not just looking at addressing the symptoms of these things anymore. We are looking upstream and seeking the underlying causes of those things as community health workers. we've taken like the absolute best concepts of like mental health, being able to provide good mental health, being able to provide good physical health, and like being able to see the whole person. Like we were able to take all these little pieces. Like I feel like we're like mosaics, and we like put it into us, and we're like, okay, like let's figure this out. Let's get good stuff done.
Yeah.
And getting good stuff done sometimes takes looking at the underlying causes, and the community health worker model that NorthLakes has adopted, but has been exactly that.
And if somebody wants to utilize your services, how do they do it?
Stop in, call, get referred through a provider that's here, but just stop in. Like I said, our front desk professionals are so good at understanding needs and accommodating people, and we're that no wrong door. If someone has a problem and they might not be sure where to go, they know that if they have a conversation with one of us, we'll kind of flesh that out. What's most important today for you, and get started on that.
Yeah. Schedule with us. I'm excited to meet you. Like genuinely, always.
Give us a call.
Yeah, give us a call.
Give us a call.
Yeah.
Right.
No wrong door, right? Like Brenda said that. No wrong door.
I got one last question for both of you. And that's what's in your car right now?
Oh God.
What's in my car?
What is in your car right now?
Can of hairspray.
Oh. This is an embarrassing question for me right now.
Oh, I mean, not a lot, but that bottle of water and a can. I'm so boring. Sorry.
No.
And dog hair.
Yeah, for real though. For real. In my car, I have I think it's a 150 watt Bluetooth speaker with like microphone connected to it. I have a box of food just in case I get off the side of the road. I have water. I have underwear, toilet paper, a spare shirt, an extra pair of pants just in case. I know. I have, and it keeps going. I have laundry detergent, just because you never know when, toothbrush, toothpaste, 2 knives, a fire starter, and a set of matches. So,
but no hairspray?
No hairspray.
I do have an Adele and Springsteen CD, just so you know.
That beats me, man. Yeah.
Brenda Spurlock, Christopher Ramirez. Cristobal, thank you very much.
That's all right.
What a treat to talk to you two and do this. Thank you so much for being here.
I appreciate you, Jeremy.
Yes, thank you for the opportunity.
So that was 2 of our community health workers. Both of them are in Ashland. Thank you, Brenda and Chris. It was great to talk to you. NorthLakes Community Clinic is a federally qualified health center with clinics throughout the northern, eastern, and central parts of Wisconsin. We offer a variety of services, including chiropractic, behavioral health, medical, dental, pediatric, occupational, and speech therapy, optometry, nutrition therapy, prescription services, psychiatric medication management, and recovery. You can learn more by visiting our website, nlccwi.org. Don't forget to give us some feedback on whichever platform you are using to listen to this. It helps others find the show. I'm Jeremy Oswald. I'm a marketing and communication specialist here at NorthLakes and today's host. Thanks for listening.